The last bullet is something I care very strongly about when I think of why I'm here today is because of those training programs. And many of us have probably participated in programs like that, and we need to replace ourselves or certainly educate the workforce who's going to take charge. And those things tend to be some of the first things that get cut. So, the first slide, if I remember well, I started off with some of the definitions. And the reason I think it's important to start with definitions is once I started this job, I realized that we're all at different levels. That there are always new people starting, people leave, and there are even those people who have been around for quite a long time who think they know what the terms and definitions are and really have no idea. So as the speaker this morning alluded to about disparities, or disparities has to do with differences, and not all differences are unfair or unjust. So men, for example, have prostate cancer. Women have breast cancer because of who we are. As opposed to, health inequality, whereas the systematic and unjust distribution of resources. Then there are also the social determinants of health, which are the resources that you need to achieve health equity. And now I really need a slide because there is one that I need to show you where there's a ball game that's going on, and there are 3 kids that are watching the ball game, and they're all standing on the same stool that's at the same level. And of course, the taller kid can see over the fence and the shorter kid can't. And then another part of the slide shows where the boxes that the kids are standing on are at different levels. So this way, this allows all the kids to see well. I like that slide a lot because oftentimes when you talk about health equity or health disparities, it boils down into a black-white. It ends into a race. And of course, as a speaker at the United States Conference on AIDS said, once we start talking about race, we're so uncomfortable with the topic that people head to the exit door, either mentally or with their money in their wallet, and nothing gets done. And then my third slide. And so you also saw a slide earlier about the World Health Organization framework for social determinants of health. And we know that education is important. People who have more education live longer. We know that income is important. People who make more money live longer and do better. So always ask for a raise. Don't give up that opportunity. And even within racial ethnic groups, the more money you make, the better you do. But then for HIV, STD, there are some other factors that are superimposed on that. Things such as residential segregation, right? In a lot of times, I'm a physician, and a lot of times we assume that we say things and the patient goes off and does it. And so we say, get more exercise. And we have no idea where the patient lives. And you go out and you run and you get shot, right? Or there are no parks, or there are no lanes. Or we say eat fresh fruits and vegetables, but there's no supermarket for you to get fresh fruits and vegetables. You can even, oh, wow, nice. Okay. So we spoke about education. Okay. So HIV, STI prevalence, you might be a good boy or a good girl, but it's who you're having sex with that puts you at risk for that. We know certainly if you've been through the correctional system, there's a high prevalence of substance abuse and mental health. And I think all of these things work together to create the adverse outcomes that we see. So there's some things that are modifiable and some that are non-modifiable. I start with the bottom first. We spend a lot of time talking about age, sex, race, ethnicity, social status, culture, religion. Those things you can't do anything about. I mean, you can't change my color, and I happen to love my color, right? But we talk about black and white differences quite a bit. But the things that are important are the ones that are modifiable through program intervention that government has some control over. So education, behavior, risk factors, employment, income, wealth, health insurance, and health services. So this is called the health impact pyramid. At the base of the pyramid requires less individual effort, and at the peak of the pyramid requires more individual effort. So socioeconomic factors such as education, housing, transportation, and business, if you fix those things, you help everyone, regardless of who they are. Changing the context to make the individual default decision healthy requires a little bit more healthy. But that's the whole idea behind healthy lunches in school. If you have to choose between a hamburger and celery sticks, you're going to choose the hamburger. But if you had only celery sticks, then you have no choice, all right? If you have to choose between bacon, even though you have high blood pressure, and oatmeal, you're going to choose bacon, all right? You do, I know. I saw you at the Conference on AIDS. I was watching you. So then you have long-lasting protective intervention. So things such as vaccination. You get it once and you're good, right? Then their clinical interventions require a little bit more effort. So that means you have to go to the doctor, the provider to get these things done. These are harder because they tend not to be very obvious. So taking your blood pressure pills or your anti-cholesterol meds, right? You don't get sick from cholesterol immediately, but later on. And then counseling education, believe it or not, tends to be not so effective, but that's where we spend the bulk of our time. And they're not effective, not because they're not good, and a lot of negatives there. It's because we say it once and we think for the rest of your life, you should remember it. You know, I see my patients every 6 months with about 15 minutes. And I tell them all the things they need to do, and I come back 6 months later and go, you didn't lose any weight. But I had a colonoscopy and I had to be nothing to eat by mouth. And all the food commercials and smell of foods that I saw between when I should not eat, I mean, it was crazy. I screwed up the first one. But we spend so much time talking about that, but not devoting enough time to the content of that. So it requires a multi-sector approach, which you can't see. But as alluded to, you know, we don't talk to each other in the same language or as often as we should. So housing, transportation, and so on. And housing alone is good. With housing is better than no housing. But you know what's better than housing? Is housing and food. I know it's better than housing and food, and job training. Right? So you don't give someone the keys to an apartment, to Section 8 housing, and close the door and think you've cured AIDS. It's only the start. So we have to work together, and we have to figure out exactly how to do that. This looked great on my computer. But this pyramid, when I talk about changing the context and going up the ladder, the things that we do for HIV, AIDS, that falls within that, and the tier of the pyramid, it's essentially we need to operate at all levels in order for, oh good, it's me being stupid. All right, so poverty, education, socioeconomic factors, changing the context, readily available condoms, clean needles, protective interventions, so brief interventions for alcohol, circumcision, a vaccine when it becomes available, clinical interventions such as viral load, controlled substance abuse treatment, and counseling and education, so individual level intervention or group level interventions. So you see how all of those things are important, so not just one thing. We need to intervene at all levels of the pyramid.